My name is Dr. Frank Urasek from Chicago, Director of Acupuncture at Cook County Hospital. I've had the privilege of being trained in our medicine in China. China hospitals are my mother, and you are my brothers and sisters. I trained in Guangzhou, Shanghai, Beijing, Taiwan, and finally, the gem, the jewel of the hospitals there, where I lost my heart, in Gansu province. And this is about the opportunity that I brought back to face the crisis that I was facing at home, that we are facing in our patient care in Chicago. And I was a sophomore at Notre Dame when I heard John Kennedy, who was president at the time, talk about luck being a combination of crisis and opportunity. And so that's, thinking back at that time, why I used this symbol at the beginning of our talk, because we have a crisis in our healthcare, and I was very fortunate to come to China and learn about the medicine that can help turn that around. And the next slide is a picture of my friend and fellow acupuncturist, Dr. Fisher, who was a guest also at Gansu Hospital, and we learned together about this medicine and how it could be used in surgery. And it was very fortunate, again, based on more than luck, that we found our way to this splendid hospital and learned our craft even better so that we could take it back to Chicago. So, who is Cook County Health? Let's look at that side of the equation. They were founded in 1832 next to the Poor Farm. So right from the get-go, that hospital served people who were indigent, who did not have money for care. And to this day, based on this whole proposition of health equity, we are delivering services to people of color, for the largest part, who don't have the money to take care of themselves, to be able to be taken care of in most of the hospitals in Chicago. So the bottom line here is that the mission continues. During the Civil War, we treated soldiers. Later on, as we moved along in our development, we were known for innovation. We had the first blood bank in the world at Chicago, at County Hospital. That's what it was called then. We pioneered education under the philosophy of see one, do one, teach one. We still operate that way in terms of our teaching at the hospital. So how do we apply the principles of Chinese medicine know-how that I brought back with me from China? We use it in pre-op. We use it to reduce elevated blood pressure and sugar levels, because time is precious when you're doing 60 surgeries a day. And if that person has got high blood pressure or high blood sugar, you've got to wait for it to go down or find some way to bring it down. We use acupuncture to bring it down so surgery can move along as scheduled for those 60 surgeries a day. How do we do it post-op? Well, we went to PACU during the COVID crisis and worked there to help people out of surgery. Post-anesthesia care unit, PACU. They had nausea and they had pain. And we used acupuncture and monitored them, breath by breath with their vitals to make sure that we were using the acupuncture wisely and precisely, because it is a precision-based and principle-based medicine. So we used it to help patients heal faster, based on EROS, enhanced recovery after surgery, using acupuncture. And post-op, to reduce pain, nausea, increase recovery time, and track them when they went home to see how fast they recovered and recovered their faculties and their flexibility and their mobility. Perioperative was a real mission for us. So we took that knowledge from China, from surgical, from, I'll never forget the time when the surgeon was chiseling a piece out of the patient's back, and the patient was awake and sharing the screen with the surgeon while the acupuncturists were doing the stimulation of the points on each arm. And while I watched in absolute amazement and said, I just can't wait to bring this gift back to Chicago to enhance recovery after surgery. And so we talked about that experience and some of the work we had done pre-op and post-op, and presented a poster through the Society of Acupuncture Research, which is the largest oldest international research group on acupuncture. And the first section of that poster, which is up on the screen, was the purpose of our study. The purpose of this poster is to consign to the minds of the American community of acupuncturists, as well as primary care providers and hospital-based physicians, that acupuncture-assisted anesthesia, recently branded as perioperative acupuncture, demonstrates acupuncture practiced in the surgical theater as well as before the cut and after, can have positive impact not just on patients' short-term outcomes, but also as part of a strategy to help quell the fire of the opiate crisis. So that's what brought us to Chicago Cook County Hospital as an acupuncturist. We had the crisis, and continue to have it, of 100,000 deaths in the U.S. yearly by opiate overdose. That's why acupuncture got included in the anesthesia department at Cook County Health. It was mandated by the Joint Commission on Hospital Accreditation that non-opiate options be used in the treatment of pain at the hospitals in the United States to help curtail that endless death number of people that are overdosing on meds, on drugs, on opiates. So when I showed up, thanks to Dr. Torres at Stroger, who was the chair of the pain management department, it was almost like she was tapping her watch saying, what took you so long? Because she had gotten the mandate from the Joint Commission. And I said, well, what would we be treating with acupuncture here at Cook County Hospital? She said, well, we have patients come through the pain clinic that have been shot, that have been stabbed, that have been beaten, that have been raped, that are the victim of motor vehicle accidents, that are the victim of work-related accidents. I had one patient, for instance, that was crushed by a 500-pound roll of steel and survived. And he was being treated by acupuncture for his pain, successfully. So, we went from the pain clinic to post-anesthesia recovery, PACU, to reduce pain and nausea. We used acupuncture and studied it for the prevention of cognitive dysfunction following surgery, because Patients who are 60 plus who are in surgery and have anesthesia have significant loss, can have significant loss of memory. And we found in our study that by putting 4 needles in the scalp, north, south, east, west position, a very famous configuration, that we were able to reduce cognitive dysfunction by 30%. Acupuncture, and this is the big win for us in a danger crisis scenario. Acupuncture has played a significant role in our emergency department. Two things about that location in the hospital are interesting. Now, we have one of the largest, oldest, busiest emergency departments in the country. And many of these patients have wound up really dependent on their meds following surgery, following emergency procedures. And they also have had a carryover effect of that dependence on these drugs for their pain. So along comes SAMHSA, which is a federal agency that is looking for ways to provide health equity to people who come through surgery, who they would like to find a way can reduce their dependence on opiates, both following ER and following surgery. And they gave us $1.5 million to study if acupuncture could in fact change their dependence on drugs coming through ER, just like we've been doing post-surgery in PACU. And we did a study on that. We did a poster of research on that situation, which is on the screen now. It shows some remarkable effects. We were able to significantly reduce the amount of pain following acupuncture and significantly reduce their drug dependency. And there's a little chart up there on the people that come to our emergency department and are treated, and it fits the profile of the patients that we want to offer more health equity to. So we polled them. We polled them both during treatment. Then they came for 6 follow-up visits to our clinic right next door to ER. And then we polled them when they went home and came back for 5 more visits. And we came up with quite a story. The story was so dramatic that when we took that poster to the American Academy of Medical Acupuncturists in Dallas, when Lisa Seaman took that, because she's the project manager, I'm the project advisor. When she took that poster to the American Academy of Medical Acupuncturists, which is about 10,000 docs who are very interested in our medicine, it won a 2nd place. It got lots of attention. We then took it to the Society of Acupuncture Research in New York City last month. Again, it got singled out for special focus because it is a crisis opportunity scenario. We are in trouble with the use and overuse of drugs, and acupuncture fills the gap, and that's what we're researching, and that's what we're proving, and it's resonating both with patients and with doctors. That's crisis opportunity. And we'll be doing the same thing up in surgery when we're doing fractured tib-fib repair and using acupuncture-assisted anesthesia real time. So we've used it before surgery, we're going to use it in surgery, and we've used it following surgery. So we had 3 conferences that we presented this poster at. One was the Midwest Pain Society Conference. It won a 2nd place for attention, for traffic. the American Academy of Medical Acupuncture in Dallas, and then the Society of Acupuncture Research meeting in New York City. And one of the other posters that we presented was at the SAR meeting and Society of Acupuncture Research meeting in New York, was our second big problem we've got here in the U.S., suicide. It's up. It's up dramatically. It's up dramatically across the board. It's up with our veterans, 17 suicides a day. It's up with our older men dying earlier by suicide, by their hand. It's up dramatically with teenagers. And so we're doing a study with our pain patients because in this poster on ketamine treatment and acupuncture for depression and anxiety, the continuum is this. You have chronic pain. Following that chronic pain that has no relief or very little relief, you get depressed. Following that depression, eventually some of these patients get suicide ideation. And this poster is a story about a patient of ours that we used the hallucinogenic medicine of ketamine. We used acupuncture to moderate that, the effect of that drug. And we used, as a referee, in the middle, we used psychiatric counseling to be able to provide a level of service in an integrated model to address one more crisis in our medicine or in our medical community here that we are faced with, which is an increased death by one's own hand. So, we have an opportunity here. We have an opportunity to ionize our experience that we discovered in China, used in the hospitals. We have an opportunity to ionize by information. We need to inform the Western medical community of the benefits of this medicine. And Gansu Provincial Hospital has an incredible journal, Western Journal of Chinese Medicine. I've spent 20 years publishing the Oriental Medicine Journal here in the United States. It was before its time. It wasn't ready. Now, with the popularity of acupuncture, a journal of the quality that Gansu Hospital is publishing needs to be put in the hands of the hospitals and the doctors throughout the country to demonstrate, to inform people of the power of our medicine. We need to educate. So from information comes education. That's the second ion. We need to educate the physicians, the chiropractors, the physical therapists, the acupuncturists. We need the nurse practitioners, the physician assistants, we need to educate them in the power of this medicine so they can refer their patients into the hands of this care on an integrated basis, the way you've been doing so powerfully in the hospitals across China. So information, education, and application, the third ion. We need to demonstrate how this medicine works on an evidence basis so that it's very clear that this is replicatable and reproducible medicine. I have patients come to our clinic at Stroger Hospital, thanks to the training I've had in China, and they are amazed. They think it's a miracle that they can walk when they couldn't walk, that they can use their arm when they couldn't use their arm, that they can actually fold up their walker and walk out of the acupuncture room, or take their crutches and put them on their shoulder without drugs. They get a jump start on recovery thanks to this medicine that I learned in China and brought to the second largest hospital in the country that was founded in 1835 to provide care for those less fortunate in Cook County. That's the mission. We are partners in delivering that in a time of need, to facing that crisis with the opportunity that acupuncture can bring to advancing the health and reducing the suffering of people here and around the world. So thank you very much. Thank you for giving me the opportunity to be trained in the hospitals, particularly the hospital Gansu, with my good friends there. And it's not incidental that this conference is being held at the corridor, at the passageway that is famous for conveying knowledge, conveying art, conveying precious goods across the Silk Road from one part of the world to another, sharing that information. And that's what we're doing in this alliance, in this transmission of knowledge and information from Gansu province to the United States and around the world. So thank you very much for the opportunity of being able to share my vision, my dream, my life with my brothers and sisters in China.